Hello and welcome. If you've ever felt that deep, frustrating ache in your shoulder that just refuses to go away, or a sudden stiffness that makes the simplest things feel like a huge effort, then this is for you. We're going to gently unpack one of the most puzzling shoulder conditions out there, the frozen shoulder. It really does often start so subtly, doesn't it? Maybe you're just reaching for something on a high shelf or putting on a coat, maybe even just trying to scratch your back. And then, ouch, there it is. A sharp, almost blocking kind of pain where there was nothing before. That simple, everyday motion is suddenly a real challenge. And that feeling, that journey from a nagging little ache to a joint that feels like it's completely locked up in a block of ice, well, it can be really alarming. It can feel pretty isolating. But I really want you to hear this. You are not alone. This is a very real, recognized medical condition, and there's a clear reason for what you're feeling. Okay, so let's get into the official term for it, adhesive capsulitis. Now, I know it sounds complicated, but it's actually a perfect description of what's going on. Adhesive literally means sticky, and capsulitis, that just means inflammation of the capsule. So what's happening is the flexible tissue wrapped around your shoulder joint, it's gotten inflamed, thickened, and tight, basically sticking the joint together. So you might be wondering who usually gets this. Well, it affects about 2 to 5% of people overall, but we see it a lot more often in women, typically between the ages of 40 and 60. And there's a really strong connection with diabetes. In fact, for people with diabetes, the risk is much higher, and unfortunately, it can often be more severe and a bit tougher to treat. To really get our heads around this, we need to picture what's happening deep inside the joint itself. What is actually causing this intense stiffness and this awful pain? Let's take a closer look together. Okay, so on the left, you can see a nice, healthy shoulder capsule. Just think of it like a loose, stretchy balloon or an elastic sleeve. It gives you all that amazing range of motion. But now, look at the right. In a frozen shoulder, that sleeve has become angry and inflamed. It thickens up, it shrinks, and it even forms these sticky bands of tissue called adhesions. The capsule literally starts to glue itself down, which shrinks the space inside the joint and makes it so hard to move freely. One of the most unique things about a frozen shoulder is that it tends to follow a very predictable path. It's a long one, for sure, but understanding this journey can actually be quite comforting because it gives you a sort of roadmap of what to expect. It pretty much always unfolds in stages. First up is the freezing stage. This is where the pain really starts to build, and you notice you're losing more and more motion, and that can last for months. Then you move into the frozen stage. Now, the weird thing here is the intense pain might actually ease up a bit, but the stiffness, it's at its absolute worst. And finally, you get to the thawing stage. This is the home stretch, a slow, gradual recovery where your movement starts to come back, but it can take a long time, anywhere from 6 months to even a couple of years. And this brings up a really crucial point. As one source puts it, the absolute best thing is to keep that shoulder moving. Even just gentle, daily range of motion exercises can sometimes help stop that capsule from locking down so tightly. But of course, what do you do when it's already taken hold? And that leads us to the most important part of our chat today. Because while this condition can take forever to resolve on its own, the good news is you don't always have to just wait it out. Modern medicine gives us some really effective ways to step in and actually speed up that thawing process. So let's just ask that question. What if we could take that long, painful journey and shorten it significantly? What if we could fast forward to the thawing part? Well, we can. There are a couple of key interventions that are proving to be real game changers. Let's look at these two powerful options. On one side, you've got something called hydrodilatation. Think of this as a mechanical fix. It physically stretches out that tight joint from the inside. Then, on the other side, you have a suprascapular nerve block. This is more of a neurological approach. It dials down the pain signals, which then opens up a window for therapy to really work. They attack the problem from different angles, but they can be incredibly effective together. So first, let's dive a little deeper into hydrodilatation. The name is a mouthful, I know, but the idea behind it is actually quite elegant. If that sleeve around your joint has shrunk and gotten tight, this procedure basically aims to gently inflate it back to its proper size.
And this is a great illustration of how it's done. A specialist, using imaging to guide them, injects a special fluid right into the joint space. It's a mix of saline, a corticosteroid to fight the inflammation, and some local anesthetic to keep you comfortable. And that fluid, we're talking 20 to 45 milliliters, physically stretches the capsule, helping to break up all those sticky bits and create more room for the joint to move. The research shows this has a really lasting positive effect on both pain and function.
All right, now let's switch gears to that second intervention. I want you to think of the pain from a frozen shoulder like a car alarm that's just stuck on, blaring 24/7. It's exhausting. A suprascapular nerve block is like having an expert come in and temporarily quiet down that overactive alarm system. So there's this nerve called the suprascapular nerve, and it's basically the main highway for pain signals traveling from your shoulder to your brain. By carefully injecting a local anesthetic right near that nerve, we can temporarily block those signals. And this does more than just give you some immediate pain relief. It breaks that awful cycle of pain and muscle tensing, which suddenly makes physical therapy not only tolerable, but actually effective. Now, of course, it's one thing to talk about how these procedures are supposed to work. It's something else entirely to see what the evidence says. And honestly, the data here is really encouraging. 64%. Just let that number sink in for a second. When you're living with constant pain, a number like that represents a massive shift in your day-to-day life. So what does that number mean? Well, a major study looked at patients who got a series of these nerve blocks, just 3 of them, once a week. After only 1 month, they reported, on average, a 64% reduction in their pain. The group that didn't get the active treatment, they only saw a 13% improvement. So you can see, that's a huge, clinically significant difference. And at the end of the day, that's what all this is about, right? What this really means is getting back to your life. It means being able to sleep through the night again, getting dressed without that jolt of pain, just being able to lift your arm. It's about taking that long, frustrating timeline and compressing it so you can reclaim your life from pain so much faster. So just understanding that these options exist is a huge first step. The next part is figuring out, well, how does this apply to you? How do you start that conversation about your own path to feeling better? Here's a really simple way to think about it. First, just acknowledge what you're feeling. Give yourself permission to say this isn't just a minor ache, it's a real condition. Second, get prepared for your next appointment. Just jot down your symptoms, your worries, and any questions you have. And third, discuss it. Open up a conversation with your doctor about all the possibilities, from physical therapy to the kinds of interventions we've talked about today. And that really brings us to our final thought here. A frozen shoulder can absolutely feel like this long, dark tunnel, but you don't have to just passively wait for the light at the end. With the right information and by working together with your doctor, you can take real active steps toward relief. So the question to leave you with is, could one of these interventions be the key? Not just to unlocking your shoulder, but to unlocking your life from the grip of pain. It's a really helpful question, and it's definitely one worth exploring. Thank you so much for your time.